So to begin cardiac auscultation of the dog, you want to make sure that the stethoscope earpieces are facing forward, and mine are. So that just allows you to make sure that you're actually listening to what you're doing. And then you're going to press firmly on whatever it is that you're listening to with the diaphragm of the stethoscope. Okay. But first things first, we're going to make sure that that we feel the cardiac impulse first. So that would be around the area of the heart. So like here, and just kind of feel for that heartbeat. Yeah. So that would be something that you do first. And yeah, now we'll actually begin ausculting the dog. So on the left side, you have the pulmonic valve. So here, around here, pulmonic valve. You also have the aortic valve over here, and you also have the mitral valve. So at each of these sections, you're going to listen for 10 to 20 seconds. So pulmonic valve, listen 10 to 20 seconds. Aortic valve, 10 to 20 seconds. And then mitral valve, listen for 10 to 20 seconds. Yeah. And on the right side of the dog, you have the tricuspid valve. So you're going to listen to that right over here for 10 to 20 seconds. And to determine heart rate, what you're going to do is you're going to, count the amount of heartbeats that you feel for about 15 seconds and then multiply that by 4. Yeah. And another thing that you'll want to do while you're ausculting is you'll want to, use your stethoscope and be listening to the heartbeat and everything, while also being mindful of pulse and making sure that the pulse matches with the heartbeat that you're hearing on the stethoscope. So what you'll do, or making sure that they're synchronous. So what you'll do is you can look at the femoral pulse back here. You can feel for that and just make sure that those are synchronous. And you can also, I think, even check for the cardiac impulse and make sure that that is, synchronous as well with the heartbeat that you're hearing. All right, that's all. Thanks.